Yes, Suman, we are live now, I guess.
Good evening, sir. I, Shuman, on behalf of Shield Healthcare, welcoming you and all the participants in today's webinar. And the topic of the today's webinar is the role of nutrition in COVID pandemic. And our guest speaker is Dr. Mrutunjay, sir. So before moving into the webinar, let me introduce our Shield Connect platform. This is a Shield Connect platform. Here you can find different blogs written by eminent doctors in different topics. So you can find the blogs here, and these are the thing we have been webinar we have already conducted in our platform. You can find the webinar in that tab, and this is the most important thing is a respiratory immunity blog. Here many respiratory immunity blogs are there, and these are the PCOS awareness tab. Here you can find different topic in different regional languages as well. And the most important thing is our key opinion leaders, and across India, almost 250 doctors are currently supporting this knowledge sharing initiative. And now let's move on to our today's webinar, and it is my honor to introduce Sir. Sir is a MBBS MD Pediatrics Advanced Postgraduate Pediatric Nutrition APGPN from Boston University School of Medicine, USA. Sir is the Professor of Pediatrics, Institute of Medical Sciences and SUM Hospital, Bhubaneswar, Odisha. Sir is the editorial reviewer at Journal of Clinical and Diagnostic Research, Curious Journal of Medical Sciences. Sir has many publications in various national and international journals of well-reputed and related to the child health related articles in newspaper, magazines, school books, etc. Sir has many awards to his credit, and out of that, just few I'm highlighting. That most outstanding academician award by State IAP 2019 is John Purbanchal Shishu Pioneer Award 2018. Sir is the PG and UG examiner. External examiner. Sir is a life member of Indian Medical Association, member of Executive Committee of International Pediatric Association, APSSEAR, member of Asia Pacific Pediatric Association, that is APPA. Sir is the member of Executive Board of Central IAP, Executive Body Member of Eastern CIAP ID Chapter 2020-2021. Sir is the Scientific Committee member of Eastern Academic of Pediatrics 2019. Sir has held various positions at State IAP, contributed to national, zonal, and state conferences of IAP. Sir is the organizing secretary Eastern Pedicon in 2019, Odisha Vaccinodiacon, and State Netcon 2018. Sir has organized various CME programs, workshop, training programs, seminars, and webinars as well. Sir is the faculty and speaker in various CME webinars. As I mentioned already, Sir is the principal investigator on rotavirus vaccine impact assessment surveillance and interception association CMV Vellore funded multicentric study. Sir has conducted neonatal SNCU mentoring at MKCG Medical College, Berhampur, Odisha on behalf of NHM sponsored by UNICEF. Sir is a delegate at updated National Nutrition Program and Strategies in MBBS Curriculum, Berhampur, Odisha 2018 by UNICEF, and many more. So with this short introduction, I request Sir to take over this session, and meanwhile I request all the participants for their active participation, and please post your queries on the QA dashboard of the Shield Connect page. So once our talk will be over, so we shall have a short discussion on this topic. So over to you, sir. Thank you very much, sir.
So thank you, Shield Healthcare, for this nice introduction. And thank you, Suman, for your lot of things you have collected from the biodata. So, okay, thanks a lot and giving me the opportunity at the outset. Totally team, I must thank to all of you. And at the outset, I must say that this is a great day for ODI people, for ODI, I mean from Odisha. We can say happy Rojo to all the female, those who are participating today. May all unmarried, especially married also, they also participate in this Rojo festival. So I wish you a happy Rojo from me, and also wish you all the good health and stay safe for this in this COVID pandemic. And to start with, I must share my screen. Am I allowed? Can I share my screen now?
Yes, sir. Yes, sir.
Okay. So to start my presentation, the role of nutrition in COVID pandemic. At the outset, I must say that like in the initial part of our discussion with Shield Healthcare General Manager, people are not at all taking any concern regarding the nutrition in COVID pandemic. Only they are planning for what to do, what medicine to take, whether to take antibiotics or not, whether to take cough syrup, whether to take nebulization, remdesivir, steroid. All those things they are discussing, but very little or very less knowledge or very less sharing of knowledges among the people affected with COVID. Also, they who are taking precautions for COVID, they are not very much aware about the role of nutrition. So today in this 45 minutes or 1 hour of this brief presentation, we will know how nutrition is so important for prevention of this SARS-CoV-2, number one, and how nutrition can balance this COVID infection as well as our normal lungs. I mean the protective effect of our lungs. So a high percentage of COVID-19 deaths worldwide are associated with one or more chronic conditions. So as of date, you can see that the total number of deaths till now in India is almost 3,75,000, and in world it is almost 37, 10 times, almost 37 lakhs. So it is a very, now this COVID-19 second wave is very, very creating a lot of havoc in throughout the country, especially in India and throughout the world. And it is evident that older people are at higher risk for severe illness with pandemic. But we have seen that in this second wave, not only older people, the younger mass is also affected. Alongside the worldwide effort to deliver the best vaccine, there has been a surge of interest in the epidemiological factors that underlie susceptibility to COVID-19 and its progression to explore the most effective preventive and curative options. So understanding the relation between nutritional status and risk of COVID-19 is therefore critical. And nutrition is not a cure for COVID-19, but it is a modifiable contributor. So we should remember that this is not the curative agent for the COVID-19, because it is modifiable. The risk factor which are there, that can be modified with the proper nutrition advice. So that is not the direct effect on COVID-19. It has got some indirect modifiable effect. So as you all know, 2014 and 16 Ebola virus outbreak in Western Africa demonstrated that immediate supportive care and significantly reduces the case fatality rate. So what has happened in 2014 to 16 Ebola virus, there was specific treatment was not there. So there is only supportive treatment was given. So like this in COVID-19, we are giving some direct treatment. Also, we should plan something related to some indirect treatment in the form of nutrition. Now, in this way, it may be applied to SARS-CoV-2 pandemic that is ravaging the world. And many emerging literature and patients on COVID-19 indirectly highlights the relevance of nutrition in possibly determining their outcomes. So it has been postulated that the nutritional status might also play a key role as a driver of SARS-CoV-2 virulence, and malnutrition is the primary cause of immunodeficiency worldwide, affecting mostly infants, children, adolescents, and elderly, increasing their vulnerability to infection. I will say a little about malnutrition, the status, the epidemiology, or the statistical part. If you see in India, every third child suffers from malnutrition. So this is a very, very problematic issue nowadays. Almost recently, it has been published in Indian Express. I will show in the next slide. Stunting, underweight, and wasting. In India, every third child suffers. That means almost 30% patient, 30% children in India are malnourished, according to Comprehensive National Nutrition Survey. Now, 23% of children belonging to age group of 5 to 9 years, 24% in adolescents, 10 to 19 years, were thin for their age, less than 2 standard deviation BMI. The current COVID-19 context could aggravate malnutrition among children and adolescents. So now, in this scenario, if you see, 1/3 of the patients are malnourished, and if there is a COVID pandemic is going on and the children or kids are affected, then there occurs a vicious cycle. Vicious cycle means there will be malnutrition, COVID-19 will be superimposed on that, malnutrition again become aggravated, COVID-19 become more, and again malnutrition can lead to COVID-19. So this is a vicious cycle. One will lead to another, another one lead to another. So the same way, the vicious cycle will cause more of damage in the kids. So the nutritional status of children is extremely susceptible to the smallest of the shocks to the body weight. A reduction in the child body weight between 0.5 to 1% can substantially increase the prevalence of underweight and wasting. And estimates say there will be 4,10,413 and 3,92,886 additional cases of underweight and wasting respectively are there in India. So underweight are like 4 lakh and 3,92,000 almost wasting. Now this is the latest data. Indian fight against COVID-19 and malnutrition. UNICEF warned this week in this report that a staggering of 1.2 million additional children under 5 could die in just 6 months in low and middle income countries. So in low and middle income country only, we should have some stress on this removal of this malnutrition, because if malnutrition is there in a patient suffering from COVID, then the chance of mortality will be higher. So we have to look for that and we have to prevent that. So children suffering with moderate or severe acute malnutrition, MAM or SAM, will be at maximum risk. So this is the clinical nutrition of ESPEN, where they have found that the prevalence of malnutrition is high, 71.83 in general cohort of COVID-19 patient as measured by the modified SGA tool. The following are risk factors for malnutrition among patients with COVID-19. That is for age, community-acquired pneumonia, and hospital-acquired pneumonia. So this is the thing. The prevalence of malnutrition now is so much important, and in this COVID pandemic, we have to prevent the malnutrition. We have to prevent the progress so that our children morbidity and mortality can be prevented. Then again, another study in China, Wuhan, China. So the conclusion of that study, the prevalence of malnutrition. The prevalence of malnutrition in elderly patients, they have done in elderly with COVID-19 was high, and nutritional support should be strengthened during treatment. So they have done in the elderly age group. They have also found that this is also similar in their in condition like pediatrics. Now, this all of us must be knowing by now. By this pandemic, we know that the kids are less affected, 0 to 4 years of age, to 5 to 17 years. So you can see if you see the reference range at the 5 to 17 years old, you can see less than 1 time is 0 to 4 years, less than 2 time will be around from the 5 to 17 years is there in the hospitalization, and death will be less than 1 time. So the thing is that in a nutshell, I can say from the 18 to 40, in this COVID second wave, in the first wave, we found that more than 60 years patients were more commonly affected. Cases were more in those age group. Hospitalization also were more in those age group, and also death. But in the second pandemic, we found that 30 to 40 years patient, 30 to 40 or 50 years patients were most commonly infected. Death also similarly more in those groups. But till now, the first and second wave is also going to end. Now we have not seen so much of pediatric casualty or pediatric cases. Up to, you can see, if you calculate, if you combine this from 0 to 20 years from our Indian data, you can say that from 0 to 20 years, we are around 7.5 to 8% cases of all total cases. In India, we are getting around 8% cases, and mortality is almost less than 1%, and hospitalization is around less than 5%. So you can see the status in children is not so virulent, not so common as of now, but nobody knows what will happen in the third wave, which everyone is predicting that in third wave, the pediatrics population will be more commonly affected. The debate is still continuing, whether it is due to less vaccination, whether it is due to unvaccination, or whether it is due to the mutant strain, whether it is due to the poor immunity in the kids, or whether it is due to the poor nutritional status in the kids. We can have third wave in which the pediatric patients will be affected, but still there is a dilemma, there is a doubt, there is a debate going on. But at least we should be careful for our kids, that at least nutritionally we should make our kids healthier, and we should make our kids vaccinated. And for that reason, our government of India should make a policy to at least vaccinate the kids at least from 12 to 15 years or 18 years age group, so that 12 to 18 years population, as well as the young adults and elderly population, can protect the kids like a shield. Like your shield healthcare, they can protect like a shield from the periphery. That virus will not come to the home or affect the young kids. So that is the most important motto to prevent our pediatric population in the third wave. So this is already I have told you. So this wave, 21 to 30 years, almost this much, 20 to 25%, and this is combinedly, I have told you, almost 7.8 and 3.9%, almost 3 to 8% infected. Now, COVID-19 and dysregulation in the immune system, we know that this COVID-19 is a notorious virus. It is an RNA virus. Mutation is going on, and it is causing a dysregulation in the immune system. It is 100% sure. There is no doubt in that. It is only because our dysregulation of the immune system, someone is affected more, someone is getting admitted, getting into getting non-infected but asymptomatic. So there is a dysregulation in the immune system. Somebody is getting more affected, somebody getting less affected. So on entry, the SARS-CoV-2 virus binds to human alveolar epithelial cells, activating the innate and adaptive immune system, resulting in the onset of the cytokine release. That is number one. This systemic cytokine barrage dysregulates the host immune response, leading to the development of the ARDS. Elderly patients are at greater risk of cytokine storm and more likely to be significantly impacted. And COVID-19 patients have a high level of interleukin 6 that already being proven, and we are doing this test. We are doing this interleukin 6 level in all the blood tests in severely affected patients. So that is a critical inflammatory mediator or marker for multi-organ dysfunction. Now, patients with severe COVID-19 symptoms and pneumonia had high levels of pro-inflammatory cytokine, that is IL-2, IL-7, GCSF, and TNF-alpha. And this elevation of cytokines lead to hyperinflammation and severe hypercytokinemic state of inflammation. And COVID-19 infection results in elevated level of IL-6 with higher mortality. And patients have also been shown to have dysfunctional immune signaling, particularly in the human major histopathology. So what is happening? There is a reduction in the T and B lymphocyte and natural killer cell activity here. So that is the most important thing. And the cytokine storm that is mediated by this IL-6 and also IL-2, IL-7, GCSF, and TNF-alpha is the most important molecular mechanism by which we are getting a lot of cases of COVID-19 that is becoming serious nowadays. So how this nutritional intervention will make these things clear from our mind that, okay, this nutrition can, this type of vitamins or minerals can prevent these hyperinflammatory states. So let us discuss on the nutritional intervention. Now coming to the PEM, already I have discussed. PEM is the major cause of immunodeficiency in worldwide. So if PEM is there, so there will be immunodeficiency, and immunodeficiency already I have told you it is related directly to the T and B lymphocyte and NK cell function. That will be one of the important factor of high mortality in COVID-19. According to 2020 Global Nutrition Report, an estimated 820 million people worldwide, 11% of the global population are hungry or undernourished, and the majority are found in the low and middle income countries. So we know that in our India, we have 1/3 patients are undernourished or more, they are having malnutrition. So if you consider the global issue, global is 11%. Globally, PM affects at least 1 in 5 children less than 5 years, with the greatest burden in the low and middle income countries. And already I have discussed wasting and stunting, no more to discuss those things. So in the current SARS-CoV-2 global pandemic, there is an urgent need to identify the PM related conditions. So how we can address this condition? So we have to first diagnose our PM cases, and we have to protect our PM or protein energy malnourished cases from getting COVID infected. Although COVID-19 primarily affects the respiratory tract, patient can also have gastrointestinal symptom. We are already seeing in our pediatric population now the COVID-19 infection, now they are presenting with usually abdominal pain, vomiting, diarrhea. Abdominal pain, vomiting, diarrhea, little bit of fever. So this is the now presentation. In the first wave, the presentation was cough, cold, and difficulty in deglutition, throat pain, like that. But in this second wave, we are getting abdominal pain, nausea, and vomiting. That means there is some type of portal of entry is there from the virus. It's not only infecting the lungs, SE2 receptors, there are also SE2 receptors in the GI tract. So that is being infected and causing this type of GI symptoms. So vitamins and trace elements, we can know there are many vitamins and trace elements in the body. We are not able to get all these things from the food every time. So vitamins and micronutrients can significantly impact, that we will discuss over the COVID-19. Micronutrients are essential for building up barriers to prevent pathogens from entering the body. They identify and eliminate the pathogens and creating an immunological memory of the pathogen. So most importantly, what we do, if any virus or any bacteria or anybody, any foreign things going into us, it should have a memory, so that in the second time when that same thing will come to us, we'll have some protection, we'll have some shield, like that. Here, micronutrients will work like this. If you give micronutrients like vaccine, this also work. Vaccine micronutrients will work like a vaccine. So they will prevent, they will cause a barrier type function. They will eliminate the pathogen. They will try to eliminate the pathogens. And most importantly, they will create an immunological memory. So that is very important for vitamins and trace minerals. Now coming to lot of discussion, lot of webinars in this last 1.5 years we have gone with vitamin D. So there is a definite role. So we cannot say that there is no role of vitamin D. There is a role and there is a definite role of vitamin D in COVID-19 pandemic. So I will tell you about the different role of vitamin D. Number one, vitamin D enhances the innate cellular immune response. So by expression of antimicrobial peptides such as cathelicidin and defensin. So these are the two important antimicrobial peptides for which vitamin D is responsible. Defensins maintain tight gap junction in the respiratory epithelium, adheres and enhance the expression of antioxidative genes. Viruses such as influenza are known to significantly damage the integrity of the epithelial tight junction. So that will be prevented by this defensin. So tight junction is being maintained by vitamin D. Vitamin D modulates the adaptive immune system by suppressing the T helper cell and decreasing the production of the pro-inflammatory cytokine IL-2. I have already told you the cytokines which are pro-inflammatory, IL-2, interferon gamma. So these things will be reduced by vitamin D. Vitamin D also promotes anti-inflammatory cytokine Th2 cells and indirectly suppressing the Th1 cells, diverting the pro-inflammatory into anti-inflammatory phenotype. So there is a regulator, we can say that there is a T lymphocyte two types, Th1 and Th2 cells. So Th2 are anti-inflammatory, Th1 are pro-inflammatory. So there is a balance would be there. So this thing is being maintained by vitamin D. That maintains Th2 expression will be more, Th1 expression will be less. Deficiency in the vitamin D has been suggested to increase incidence of severity of COVID-19 and supplementation will boost the immunity. Now, it is very, very important to know that how this our RAS, how it affects. That is our renin-angiotensin system. How it is very, very important regulator of vitamin D and how it impact. What is the impact of this RAS on our COVID-19 infection? Now, if you go to the diagrammatic representation, we can see there is a 125. This is active form 125 dihydroxy vitamin D. So what they are causing, now vitamin D can act on the RAS to promote tissue protection from SARS-CoV-2 infection. SC2 is the primary entry point into the cell. SARS-CoV-2 down-regulates expression promoting tissue injury. So the SC2 SARS-CoV-2 will be infected by this. This is promoted. That means the SC2 expression will be there. SARS-CoV-2 can bind. But simultaneously, it is causing the angiotensin 2 to angiotensin 1, in which even if the SARS-CoV-2 getting more of expression through these receptors, this tissue injury part, which is angiotensin 2 to the angiotensin 2 receptor at 81, this is very important to understand because this is a molecular level, physiological level of things. So 125 dihydroxy, though increases the SC2 receptor for the attachment of the SARS-CoV-2, but SARS-CoV-2 virus cannot get the tissue damage because this angiotensin 2 will be promoted to angiotensin 1 because of this plus effect of SC2 of 125 dihydroxy 1. So this angiotensin 1 is having a tissue protective activity, that is anti-inflammatory, anti-proliferative, anti-fibrotic, antioxidant. So whenever we are getting a lot of angiotensin 1, then we are getting this type of tissue protection. But when we are getting a less number of angiotensin 1, we will be landing into trouble. The angiotensin 2 will be attached to the angiotensin 2 receptor and there will be tissue injury. So this is the basic mechanism in which the vitamin D itself helpful for us. So that should be, everybody should know it has got a very good important effect on our renin-angiotensin system. Now this already I have told you, there is no need to go for that in description part. Now another thing important is that SC2 receptors are found in the lung tissue, at heart, kidney, endothelium and intestine. So only previously in the past it was only thought that only the lung is involvement, but now heart, kidney, endothelium, intestine, everywhere there is SC2 receptor, and SC2 plays a very important role in counterbalancing the negative pro-inflammatory downstream effects triggered by the angiotensin 2. Already I have discussed. So though the receptors are more, but the SC2 itself plays an important role from converting angiotensin 2 to angiotensin 1. This angiotensin 1 is anti-inflammatory. So although SARS-CoV-2 must bind to the SC2, penetrates the cell, simultaneously downregulation by the SC2 causing less damage to the tissues. Now, these are the lot of studies, registered trials, vitamin D in different part of this world. And in India, there is one study, registered study is going on. They are giving 60,000 IU dose of vitamin D, 30 participants. Inflammation and COVID-19 status, hospitalization is their outcome. And India is the country where this is being done. So, lot of ongoing trials are different countries are doing, but India is also participating in one trial. Let us see what is the result coming out. They will be publishing the result very soon. Now coming to vitamin C. Now everywhere we know that in COVID-19, if somebody is infected, so everybody is telling to go and get that vitamin C, Linseed or Suxi, whatever is available. So is there any role of immunomodulatory role of vitamin C there? So to know that, we have to go to the vitamin C physiology. Vitamin C is antioxidant, everybody knows. Vitamin C accumulates in the leukocytes, concentrated 50 to 100 fold higher than in plasma. During infection, vitamin C present in the leukocytes rapidly utilized. Disturbance, if any, occurs between the antioxidant defenses and oxidant generation can alter multiple signaling pathways. So what is the role of antioxidant? Antioxidant is the property of any chemical or any nutrition. If having antioxidant, that means it prevents the oxygen-free radical injury of the tissue, so that the oxidant generation can be hampered. And this can alter multiple signaling pathway involving pro-inflammatory transcription factors such as nuclear factor kappa B. So now increasing level of oxidant lead to activation of the NF-κB, triggering a signaling cascade with the result of further production of the oxidative species. So what is happening? The most important antioxidant effect that is being done by vitamin C, if there is a deficient state, this will not be there. So the generation of oxidant species will be there, and this pro-inflammatory NF-κ-beta will be produced. Now, what is happening in COVID-19? These pro-inflammatory cytokines, IL-1 beta and TNF-alpha, increase rapidly after infection, and the acute response triggered by these stimulates further secretion of IL-6 and IL-8, promoting an ongoing pro-inflammatory state. So vitamin C is known to reduce the level of pro-inflammatory cytokines, including TNF-alpha, and increasing the anti-inflammatory cytokines IL-10. So now we can know that one of the anti-inflammatory cytokine is IL-10, which is being promoted by vitamin C. Though vitamin C is antioxidant, one of the anti-inflammatory cytokine effect is also there by vitamin C. Now the role demonstrated that intake of 1 gram per day of vitamin C increases the IL-10 secretion by peripheral blood mononuclear cells. IL-10 work as a negative feedback mechanism with IL-6. So negative feedback means if IL-10 will increase, automatically the IL-6 will decrease. So that is the way in which vitamin C works, and vitamin C is always antioxidant. Along with that, it produces more of anti-inflammatory cytokine, that is IL-10. So these are ongoing studies. So no study in India now currently. China, Italy, Canada, Australia, they are having ongoing trials. The results will be published very soon. The same outcome they are telling: ventilation-free days, hospital mortality, decreased death rate, all these things they have taken into consideration. They are doing the registered studies. So let us see within 5 to 6 months, we can get the data, actual data of vitamin C in COVID-19 infection. Now coming to vitamin A. Now for pediatrician, I can say over here, a lot of pediatricians will be listening to this webinar. So vitamin A is a very, very important vitamin for our pediatric population. Any patients coming to us, we should search that there is a hypervitaminosis A is there or not, or vitamin A deficiency state is there or not. Also, WHO and Government of India recommend vitamin A prophylaxis during immunization also. So this is considered one of the vaccine, because in 9 months and after that every 6 months we are giving vitamin A to our kids. So this is a normal vaccine, like a normal vaccine. So vitamin A is very, very important for pediatric population for prevention of lot of diseases, not only COVID-19, for lot of diseases. And how it prevents lot of diseases? Vitamin is the effectiveness of viral vaccine is compromised by low serum vitamin A through the suppression of IgG1 and inflammatory responses. The vitamin A also modulates other immune components through its action on dendritic and natural killer cells, and it is essential in maintaining epithelial tissue integrity, which is severely damaged in viral infections such as measles, and serious COVID-19 caused by SARS-CoV-2 infection had some manifestations similar to measles, including fever, cough, and pneumonia. So the most important out of this, the summary of this vitamin A is, it has got suppression of IgG1 and inflammatory responses. It has the compromise by the low serum vitamin A will lead to low IgG and inflammatory response also less. Number two, it has got action through dendritic and natural killer cells, which will be also less vitamin A deficiency. And number three, epithelial tissue integrity. So these are the most important three mechanisms in which vitamin A is a immunoprotective. Now, vitamin E is the collective term for 4-tocopherol and 4-tocotrienols. The main biological role of vitamin E is antioxidant like vitamin C. So, through numerous possible mechanisms postulated, only few confirmatory studies are available. Maintenance of cell membrane integrity, increased and decreased cell proliferation, increased IL-2, decreased IL-6, and enhanced immunoglobulin production. So, these are the important mechanisms in which it has caused little bit of anti-inflammatory effect. Now, PUFA. Now, in pediatric, in webinars, lot of discussions were gone through last 1.5 years on PUFA also. But PUFA in nutrition is mostly in the first 1,000 days of life we are discussing. But PUFA in COVID-19, less discussed. So, I can say PUFA is a polyunsaturated fatty acid, eicosapentaenoic and docosahexaenoic. DHA, everybody must be knowing about the DHA. Now, omega-3 fatty acids exert antiviral effects inhibiting influenza virus replication. This has been studied and postulated. According to the European Society for Parenteral and Enteral Nutrition expert statement, the use of omega-3 fatty acid may improve oxygenation in COVID-19 patients. So this is very important statement by the European Society. The oxygen level, the oxygenation of the tissue is improved by provision of this DHA. And few studies have suggested caution in the use of omega-3 fatty acid because citing evidence as counterintuitive increase in the oxidative stress and inflammation due to increased susceptibility to cellular membrane to damage. So there is also some oxidative stress is occurring, but some judiciously balancing if you use, then it has got to improve oxygenation status. So supplementary, particularly high dose, should be performed with care in this population. So trace elements, now we'll discuss some trace elements like we can discuss on selenium, zinc, copper, manganese, and a little bit of what is the importance, is there any role of trace elements, so that it is available in the diet. So dietary importance of trace elements, if you go through the dietary importance one by one, we'll go to the zinc role. Zinc is a key trace mineral involved in many biological processes, including immunity, and it is vital in both the innate and acquired response to viral infection. Zinc deficiency significantly increases the pro-inflammatory cytokines, and remodeling of the lung tissue is noted, an effect which is partially countered by the zinc supplements. And furthermore, zinc deficiency results in an alteration in the cell barrier function in lung epithelial tissues via the upregulation of the interferon gamma and TNF alpha. Now we know as a pediatrician, we are giving zinc in all types of diarrhea, acute diarrhea cases. We are giving zinc. Zinc is providing a immunomodulator role in diarrhea. It is proven, it is established. Now also zinc is having a key role as a pro-inflammatory cytokines, increasing the zinc. As a zinc deficiency can cause pro-inflammatory cytokine release. So that is very important to understand. So in this way, it can prevent also our COVID-19. So studies have shown that zinc supplementation is able to decrease COVID-19 related symptoms such as LRTI, and these effects have been suggested to be due to the inhibition of the viral uncoating, binding, and replication. All these pictures of the COVID-19 will be affected by zinc deficiency. So if the zinc will be supplemented, the inhibition occurs to viral encoding, binding, and replication. In clinical trial registered in Australia will determine the use of intravenous zinc. So it's continuing. So they are trying some the role of intravenous zinc, but unfortunately very less COVID-19 cases in Australia. So how they are doing the test, I don't know, but still a clinical trial is going on about the role of IV zinc in COVID-19 infection. Now this is the summary of the various zinc role. So this is the T cell proliferation and stabilization, inactivates viral replication, upregulation of the interferon production, inhibition of the SARS-CoV RNA polymerase, decreases the level of SCE2, promotes phagocytosis of the viral particles, antigen processing and presentation, trigger T cell production, like that. So lot of mechanism, which is there to prevent COVID-19 for zinc. So in previously, today also there is some recommendation, somewhere it is given that zinc and vitamin C is good, zinc and vitamin C and vitamin D, till people are getting zinc, vitamin C and vitamin D at their home, but still Government of India is not recommending. and there is no body to recommend these things as a routine protocol to treat, but at least we should have an idea what is the role, and whether this is being, with the study, with the literature is coming up, we can get this recommendation in the future time. Now coming to selenium. Selenium is also optimizes both the innate and acquired immunity. Low dose supplementation of selenium reduces the humoral immunity, and selenium increases the cell-mediated immunity through proliferation of T cell, increased interferon C, and cytokine production. Selenium also promotes NK cell-mediated immunity through porphyrin and granulocyte pathway. Selenium deficiency has shown to reduce the immunity system and favors pathogenesis of the coronaviruses. It inhibits viral replication. The virulence of the SARS-CoV-2 also depends on the penetration property into the pneumocytes, which is prevented by the selenium. Now, this is the final pathway. Selenium has got antioxidant effect, glutathione peroxidase effect, complement system, thyroidexin reductase, cell-mediated immunity, humoral immunity, cytokine production, anti-inflammatory response, and vitamin E activity. Selenium and vitamin E are interrelated. So this is the important mechanism. Vitamin C and vitamin E, if you see, there is viral uncoating, viral replication, all are being hampered by zinc. Vitamin E is also having an NK and T cell defense mechanism, and cytokine modulation by vitamin C. Now iron. Now this is very important to know that even if we are providing iron as a therapeutically to some patients for prophylaxis of anemia also. So iron, differentiation of cells and cellular growth is also regulated by iron. Enzymes that generate peroxide and nitric oxide also have iron as structural component and cofactor. Cytokine production and its mechanism of action requires iron for regulation. So here is very important. Cytokine production is also regulated by iron. So if at all we are getting any cytokine storm, iron is there for the regulation of that cytokine. Phosphorylation requires protein kinase C activation, which is an important signaling molecule for immune cell proliferation that requires iron for activation. So phosphorylation, that is done again by protein kinase C, again that is by iron. If iron deficiency stage, the slight reduction in the Rossetti forming of the T cells and impaired lymphocyte proliferation return to mitogens and antigens. So iron deficiency state, the T cell function, T cell effect will as compared in it iron non-deficient stage or in an iron normal stage. Now coming to the copper. Copper is also, you can know, the superoxide dismutase, the most common enzyme, which is the most important catalytic pathway. It is antioxidant type. Along with copper, zinc, it is also necessary for the activation of the superoxide dismutase, which can quench the ROS. And copper plays a vital role in converting superoxide antigens and oxygen and H2O2. Copper is necessary for iron metabolism. Copper in both excess and deficient condition alter the immune response. Very important to know that copper in excess also can cause infection. Copper in lower also can cause infection. So we have to balance this. And this reactive oxygen species, that is mostly the role of copper with that, like vitamin C or selenium. It is also the same reactive oxygen species effect of copper, and it plays a crucial role in the development, maturation, and proper function of the immune system. And copper deficiency decreased antibody forming cell response and increased susceptibility to viral infection. Immunoglobulin and phagocytosis are comparatively low in copper deficient children. There is significant improvement in phagocytic index after copper supplementation in those children, and proliferation of peripheral blood mononuclear cells are significantly decreased due to copper deficiency. So all these things, immunoglobulin, phagocytosis, phagocytic index, all these things are being mediated by copper. So copper is proven to be a immunoprotective minerals or trace element for this COVID-19. Now lithium, nobody knows what is the role of lithium and how many lithium and what is the importance of lithium in the food. And lithium exhibits antiviral effect against coronavirus bronchitis. Virus bronchitis type, it inhibits replication and cellular entry of coronavirus into vero cells. And lithium possesses anti-inflammatory effects by inhibiting COX-2 expression, IL-1B, TNF-A, and increases the level of IL-2 and IL-10. So activity of lithium gives a clear figure to treat COVID-19. So this cytokine related issues are there with lithium also. Nickel, very importantly in green teas we are getting a lot of nickel. Now nickel, how it helpful? Nickel, several studies have proven that nickel increases spleen, B and T cell activities and decreases the NK cell activities. So it has been observed that human coronavirus is rapidly inactivated at room temperature and an alloy surface made up of copper and nickel, probably through generation of the reactive oxygen species. So this is a study. This is an observation. The coronavirus is rapidly inactivated at the room temperature if the virus is kept over a copper and nickel subject. So in a few days back in YouTube, I got a news. One company is producing copper mask for prevention of COVID-19. So how far it is true, or how costly it will be, how affordability is will be there. So by this mechanism, by the generation of the reactive oxygen species, by the proliferation of these B and T lymphocytes, we can get less infection. So copper type of face mask can also prevent COVID-19. So this has all come in the last 2 to 3 days back. I have seen in YouTube. Anybody might have seen. So copper mask is also available in UK and US. So this is the recommended daily allowance. Nobody can remember this. Only you can paste it in the room and we can see. But zinc, selenium, iron, copper, lithium, nickel, manganese, chromium, fluoride, cobalt, iodine, molybdenum, all are equally important. And this COVID pandemic region, COVID pandemic time, we should have our nutrition should be properly balanced with all the micronutrients. Now this is the pandemic effect. Now if you go to the pandemic effect, there is a lot of interrelated things are happening. If you see, pandemic impacts economy and livelihoods, already that is being proven. Availability and access to the healthcare facilities is hampered. Food system is being hampered. Sedentary behavior because of not going outside, no exercise, nothing, and mental health. So all these things, they contribute to the overweight and obesity and susceptibility to COVID-19, and overweight obesity directly susceptible. Similarly, undernutrition due to morbidity and mortality, and they may go to progression of the COVID-19. Then we have some viral application, SE2 binding, vitamin. So these are the things which can be done. Vitamin A for mucosal immune function, vitamin A, C, D, iron and zinc for adaptive and innate immune function, pro-oxidant effect, vitamin C, not only vitamin C, vitamin E, selenium, viral application by SE2 binding site, vitamin E, selenium, iron, mutation and virulence by selenium, and anti-inflammatory, you can say anything. Vitamin A, C, E, selenium, zinc. Vitamin D, UPA, and nutritional support. So along with this nutritional support, progression of the COVID-19 may not be there, and potential nutrition therapy under testing, high dose vitamin A, C, D. So we can see that lot of nutritional intervention can prevent our susceptibility, can prevent our susceptibility to go to the progress of the COVID-19 and go to the serious form of COVID-19. So this era, we should stress ourselves for this nutrition. Those who are not suffered, or those who are in prophylaxis, those who are in home isolation, they should have an importance, have to be given importance on this diet. Now coming one of the nutraceuticals, if you go to the nutraceuticals, means anything which is proven, any nutrition that is being proven immunity or proven. So we can discuss curcumin. Curcumin is an antiviral agent that can be helpful for both prevention and treatment. The well-documented anti-inflammatory and immunomodulatory effects of curcumin, along with evidence of anti-fibrotic and pulmonoprotective effects. So in our previous days, past days, in our older generation people, they used to take haldi, you can say turmeric. So this is rich in curcumin. Curcumin is known to have strong inhibitory effects of NF-κ-beta and several pro-inflammatory cytokines. So this is turmeric, curcuma longa, used in Ayurveda, Siddha, traditional Chinese medicine. So its medicinal properties are primarily attributed to three main curcuminoids: curcumin, dimethoxycurcumin, and bis-D-methoxycurcumin. So curcumin is the most abundant curcuminoid in turmeric. Now we know that turmeric is there. Turmeric is the most important Ayurvedic preparation, or you can say the most natural preparation of immune booster. In our childhood days, lot of time I have taken also this haldi or turmeric for prevention of worm. Nowadays also people are giving haldi for prevention of worm. Now many good effect of turmeric are there in the Ayurveda in the ancient age. So now it is also we have come to that part. So turmeric is now proven scientifically that it has got some anti-inflammatory, some the anti-inflammatory effect in the form of decreasing these cytokines, NF-κ-beta, and this is the important strong inhibitory effect, and it has got a pulmonoprotective effects. So this is very important to know about the nutraceutical turmeric. So curcumin inhibits the host cell receptor. The virus attaches the human host cell target receptor, the angiotensin converting enzyme 2. So modeling studies have shown that curcumin inhibits this receptor interaction in two ways, by inhibiting spike protein and by inhibiting the receptor. So this is also important. Curcumin, how it helps for the prevention or entry part. This is being done, and if at all the virus is going enter into that, the anti-inflammatory cytokines or the pro-inflammatory cytokines will be inhibited. So this is the major part, and curcumin is also shown to confer curative and preventive efforts in the diverse forms of pathology and disorders, infection and malignancies. So US Food and Drug Administration has recognized these curcuminoids as generally recognized as safe, not GRAS, generally recognized as safe. That is by US FDA. So to conclude all this nutritional aspect in COVID-19, there is potential for nutritional intervention to reduce the individual susceptibility to infection, progression to symptoms, and likelihood to severe disease. A well-balanced diet strengthens the immune system and reduces the risk of chronic disease and infectious disease. Having knowledge about nutritional intervention that may help to prevent chronic conditions and their associated risk is now more important than ever. Because we know that we are stressing mostly on the treatment part, but not only we should focus on treatment, we should focus on the nutrition, we should focus on the minerals, vitamins, and trace elements. And especially in the era of this 30% malnutrition status in our country, if the third wave will be dangerous for the pediatric kids, these 30% patients will be at risk, always will be at risk. So to prevent those 30%, which is a very good volume, we can say 34% are there in the pediatric age group. So almost 34 means if you consider 140 crore, so almost we can get around 40 crore, 42 crore. Out of that, 30% means another 12 crore. So 12 crore, you can say, we can get a population, we can be infected with COVID-19 with serious morbidity and mortality. So that will be a great issue for us. So we should be careful and we should be giving good nutrition advice, and at least we should consider them that this is the way we can prevent the disease progression to a severe form. So this is all about the things, and many of us do know that this adequate amounts of vitamins and minerals diet is not possible. So we have to give some extra foods, some extra vitamin supplementation. So zinc, all these things are to be given. Fruits, vegetable, meat, poultry, everything we have to provide. And supplementation with higher doses of these nutrients during COVID-19 infection have shown positive outcomes. So this is all about the conclusion about the nutrition in COVID-19. And these are the references. And thanks everyone for the patient hearing. So this is the final slide: exercise, learning development, nutrition, rest and relaxation, relationship, mind and spirituality. These are the wheel of well-being. So thanks Shield Healthcare for giving me the opportunity. Now I hand over mic or my system to Mr. Suman for the next proceeding.
Thank you, sir. Thank you very much for this nice presentation and informative one. So meanwhile, I have received a few questions. So if you allow me, then we can start that one.
Okay, no issue.
Sir, my first question is, as we all know that Indian diet are rich in turmeric, and that is should not enough sufficient. So should we prescribe specific curcumin containing preparations for this time?
Actually, you cannot prescribe as a doctor, because whatever is recommended, US FDA has proven it is free, it is safe. But as a doctor, as a allopathic specialist, you cannot prescribe curcumin in your prescription. You can only advise, but for a prescription that is to be recommended by the government of India, for supposing anything, we have seen lot of vitamin A, C, zinc preparations are more effective for COVID-19. So I want to say here that even if there is proven efficacy, even if there is mechanism is there for prevention against COVID, but to get it writing in the curcumins or get it writing vitamin A, zinc for COVID-19, little bit it's a very problematic issue, but still we can write vitamin A, zinc, vitamin D, everything we can write, vitamin C also. But for curcumin, there is a hitch. It's only for Ayurvedic preparation, so we can only verbally tell them any curcumin preparation you can take, but don't write this as a allopathic specialist. That is not in our domain.
And sir, there are many pharmaceutical products available in our existing market containing the vitamins or minerals. So how do you decide the best one?
Yes, very important question. So always remember that whenever we are prescribing any vitamin supplementation, you please see the what is the composition of that vitamin A, what is the amount of that vitamin in that syrup or in that drop. So many companies, many companies, they are not adequate up to the recommended daily allowance of vitamins in their syrup or drops.
Yes.
So I request all the pharma company, those who will be manufacturing this, they should consult, their focus should be on the preparation which will give the RDA. Without that, we cannot achieve our therapeutic goal. We cannot achieve our effective prevention against COVID-19 or effective prevention immunological things. Whatever we are getting, we will not get. Therefore, whenever you choose anybody, wherever you are there, if you are choosing any vitamins, not only go by their catchy name, by their good quality of packaging, but we should go into the deep of that product. If it contains vitamin A, how much it contains, what is the requirement, what is the difference? It will contains vitamin C, vitamin D, vitamin E, zinc, minerals. Oh, how much the constituent is and how deficient are they? That we should be careful enough because many products are there. They are not up to date. I don't know. There must be some manufacturing issue because we cannot give that much of vitamin A to prepare one thing. We cannot give that much of zinc which is required. So might be there must be some manufacturing issue. I can understand. But still, we have to choose a good product which is giving at least near to the RDA.
Okay, sir. Sir, one question from my side, that is in case of pediatric inflammatory multisystem syndrome that is seen in related to the COVID-19. So in that case, remdesivir has been recommended, but although remdesivir has not sufficient data in case of pediatric patient. So in that case, what will be your treatment approach in terms of nutrition or in terms of other drugs?
In this Government of India recommendation, if you go for the central government recommendation, yesterday or only 3-4 days back it has come in the management of COVID-19, remdesivir should not be used unless and otherwise it is being severe form. But again, remdesivir use is now absolutely zero or no by the Government of India. But still, in severe cases, one may go for the use of remdesivir, and also we are using in the severe form because in the previous, the article of Government of India, remdesivir use was there. But in this article, remdesivir just published 2 to 3 days back by the Ministry of Health and Family Welfare, Government of India, they have excluded remdesivir use in the pediatric population. So that is variable, but it depends upon the case-to-case scenario. If our child is not improving, going on to ICU, getting less saturation, we should use it. There is no issue in that. We should use with proper precautions. For getting a remdesivir, why people are not using remdesivir? Remdesivir has got some nephrotoxic effect as some also hepatotoxic effect. So any patients which have been giving remdesivir, the liver and the renal function should be tested. That is very important.
Okay, sir. And sir, another thing is nowadays we can see that all are taking the zinc tablet, or parents are insisting their child to take the zinc tablet. And now research came that zinc is associated with the mucormycosis. So in that case, how to tackle this kind of situation?
So this is again, I can say this is a misnomer, or I cannot say that zinc is directly associated. Maybe zinc may be associated, but there must be something must be there which will come in the recent future. But I don't think that zinc is the direct cause of mucormycosis. Mucormycosis is the cause of untreated diabetes mellitus, untreated conditions, prolonged diabetes mellitus, prolonged infections, or prolonged low immunity. All these things are leading to mucormycosis. But zinc causing mucormycosis directly, supposing one healthy person taking zinc, mucormycosis cannot occur with that. Mucormycosis, untreated, prolonged, uncontrolled diabetes, less immunity, supposing a renal transplant patient, supposing a patient who is cancer survivor, taken a lot of chemotherapy. So these patients, they are more prone for, I can say, for mucormycosis, but zinc as per se, directly causing in a healthy patient mucormycosis, I think it is wrong. It's a misnomer.
And Sir, last question is as we are on the verge of our third wave and which will be it is predicting it will be affect our pediatric population, and no vaccine is still available with the available data itself. So how to tackle this situation? What is your suggestion?
So for this is
take
a
care
very
of
good
this
question. This is actually this question I have faced in many webinars also, and also in many TV programs recently. So the first of all, my take or whatever government of India should observe, or government of India is also understanding the thing. First of all, we should vaccinate our first priority is to vaccinate our elderly population. That means 18 to 44 and more than 44. That should be 100% without single left out. 100% or at least 80%. 80% means it will be 100%. Because in vaccinology, 80% coverage means it is 100% because of the herd immunity. So at least 80 to 85% of those population more than 18 years should be covered by 2 months or 2 months from today onwards, by July end. So that is to be taken care of, number one. Number two is, by this effect, we can get a cocooning effect, or we can get a shield effect outside the surrounding society. You can get a shield effect of those population, which can prevent our pediatric kids. Next is, we can vaccinate our 12 to 15 years age group. So that's why in one TV program I was telling that if government will introduce our Pfizer vaccine from USA and give it from 12 to 18 years, because that is studied, that is effective, that is being there tried already, and it is being given since a very long period, no side effects. So Pfizer from 12 to 18 years, and give some vaccine, give some protection, let the school be opened, let the children get some outside and get some herd immunity, because elderly populations are vaccinated, and this Pfizer vaccine people are going to the school. So 12 to 18 years means class 6 onwards, the people can go to school. Then 2 to 12 years vaccine, Covaxin is on trial basis. After 2 months, that will be ready. Then gradually on phase-wise manner, the school will be opened and people can go to the school and education cannot be hampered. And number three is, your whatever may be the situation, the COVID appropriate behavior is a must for another 2 years, I can say, from this even after vaccination. And if possible, if Pfizer vaccine is not acceptable, then give the trial from 12 to 18 years in a large scale, not only in a small scale in 2-3 centers. We should give a large scale multicentric in India, around 40 to 50 centers, 12 to 18 years, Covaxin vaccination or Covishield vaccination for the kids. And we should implement it for the country within a 1 month period. But that is the thing, what is the government of India is thinking. So the first one is the best option. 18 years and above should be vaccinated, and giving a herd immunity and giving a shield effect.
Okay. So thank you, sir. I could not find any other question. Thank you very much for your valuable time and nice discussion on this.
Thank you. Uma Shankarji, kahan gaye? Uma Shankarji, good evening, and you have not seen in the beginning also.
Yeah, I'm there, sir. I'm there.
Okay. Uma Shankarji is there. Prabhat was.
Yes.
So I am thankful to all of you, and also I am thankful to the team Shield Healthcare. We will be meeting again and again in future with some good programs. And let us conclude today. I think Mr. Jingade, any slide sharing you are doing, telling Mr. Suman?
Yeah, yes, sir. We have a small audio visual on rudimentary.
Do you want to share it? Do you want to share?
Yeah, with your permission, we just want to share it.
Okay, 1 minute you can share.
Yeah, please.
Dr. Shield Healthcare, transforming health with innovation and technology, is the winner of the prestigious Indian Health and Wellness Award. Likes to thank you for helping us achieve through your valuable partnership. Health issues like recurrent respiratory infections can cause complex physiological and biochemical changes leading to ambulatory condition. Therefore, we need a specific immune booster to strengthen the respiratory immunity. So, introducing Rudimin Mu tablets and Rudimin Mu syrup to strengthen the respiratory immunity. Rudimin Mu tablets and syrup are a specific combination of 4 bioactive ingredients along with immunovitamins and minerals. The bioactive ingredients are tinocoridin, curcuminoids, Asimenen, Osimum sanctum. Glutamine mu is also enriched with immunovitamins like vitamin A, vitamin C, vitamin D3, and minerals like zinc and selenium. As per ESPN guidelines May 20, daily allowance of vitamins, minerals, and trace elements maximizes nutritional defense for patients susceptible to frequent respiratory infections. Therefore, please prescribe Rudamine mu tablets and syrup in recurrent respiratory infections. Only Rudamine mu strengthens the respiratory immunity. Dose of Rudamine mu tablet is 1 tablet BID. Dose of Rudamine mu syrup is 5 ml BID. Doctor, Rudamine mu shields immunity. Thank you.
Thank you.
Yes.
Sir, before we conclude, we have with us our Vice President, Mr. Satish Kumar. Sir, Satish, sir, if you want to have share your thoughts with Dr.
Sir,
Das.
good evening, sir. I was hearing about the entire lecture. It was so nice. And thank you so much. And the way you said, it has to be continued, and we need to see, the time to come, we need to explore that, the importance of nutrition and vitamins. Sir, I am fully agree with you. We will work with you, and we'll see to that every children gets a proper nourishment.
Thanks a lot. Thanks a lot. Thank you, everyone.
Thank you. Thank you, sir. Thank you for your valuable time and for this nice presentation once again, sir. And in future also, we will look forward for some valuable talk from your side, sir.
So good night. Good night to one and all.
Good night, sir.
Thank you very much, sir. Again, good night.